FHIR Demo for Health Informatics at Georgia Tech. My name is Aaron Ford. My undergrad was in mechanical engineering and biophysics with a computer science minor. I worked as an engineer for 3 years, but now I currently work as a back-end developer. I'm taking this course partly because it is required for the interactive intelligence focus, but also because I thought it would be useful and interesting, and could possibly jive well with my biophysics degree, giving me an opportunity to see how we can blend science and technology. What is FHIR? Historically, medical records were kept in physical files, all the data on patients recorded in charts and kept in drawers. As technology has developed, these records have been or are being digitized. Due to the large number of offices, centers, clinics, hospitals, etc., there hasn't been a uniform method for recording and keeping data. FHIR is a framework with a set of APIs that has been making a push to be the new standard for medical record keeping, conforming the way in which medical data is stored and accessed in hopes of simplifying records and improving the treatment of patients by providing medical staff with access to their complete and uploaded records, despite the numerous medical facilities and professionals they may have seen. Here we have the GT FHIR server homepage. As you can see on the left, there is a list of resources available to us. We will explore the use and purpose of some of these resources. We'll start with patient. If we select the patient resource, we will get a search and search parameter selection. Here we have the option of searching by several filters. As seen here, we can search for a patient by their resource identity, birthday, given name, family name, or portion of a name or gender. Additional filters can be used to refine the search. For example, if I wanted to find Marla Dixon, I could add a search filter on her family name, as well as one for her first name. If she's in the database and I click search, I'll find her patient record, as well as the records of any others who share her name. I can continue to add filters as needed to find the exact patient I want. As there is only one Marla Dixon in the database, the search returns her results. A JSON is returned with the patient's info like name, address, and resource ID. Let's keep track of that number so we can search her by ID and not just her name. We've seen patient info. Now let's see what else we can find in the FHIR server. Back on the home page, we see we have the resource for condition. Let's see if Marla has any conditions we don't know about. Selecting the condition resource, we can see that we again have another search interface we can use, though this one is slightly different. The condition resource lets us search by the resource ID for the condition, by the specific code for that condition, an encounter for that condition, or the patient with the condition. We know the patient we are looking for is Marla Dixon, so we want to search by patient. Here we can again add a filter for patient last name and first name, but we have Marla's ID from her patient file, so let's search by patient resource ID. We immediately get back Marla's records for her conditions. We can see we got 4 bundles back, each bundle having information on one of her conditions. Poor Marla has chronic bronchitis, as well as a coronary arterial sclerosis, type 2 diabetes, and hypertension. We can see that the conditions resource also has information like status, verification, and the reference doctor. After seeing the list of ailments that Marla suffers from, she must be taking some medication to help treat her conditions. We can find out by checking her medication order. If we go back to our resource and select medication order, we get a search similar to the one we saw with the condition resource. Again, we have several options to search by, including a resource ID, but we will again search by the patient ID for Marla. The medication order brings up 3 bundles of information as seen in the JSON. These list the date the prescription was written, for whom it was written, who prescribed it, along with the other information for the medication, such as name and number of refills allowed. It seems as though Marla has been prescribed 3 different medications. If we continue to go through the FHIR resources, we'll find more information on Marla, like any observations or encounters she has had. There are also other resources we can look at for information on practitioners, procedures, etc., but time prevents further exploration of these at the moment. But as has been demonstrated, a patient's digitized medical records can be neatly kept, organized, and maintained with FHIR, allowing quick access to their information when needed. Looking through the version notes for FHIR, we can see that it has grown from an appointment schedule and questionnaire system to a standard for the exchange of medical information. FHIR is primed to be pivotal in completing meaningful use stage 3, which states that patients are required to be able to access their medical data through an API, and FHIR is helping fulfill this criteria.